Hey guys, and/or welcome back. So I wanted to kind of get into a little bit of what things may be considered normal findings or assessment of your newborn baby, and what we would consider something like a significant finding. So there are some things that will, maybe call out during the assessment or maybe make you aware of that are normal, like milia, the little white dots on the baby's face, kind of looks like a little pimple that you should not pop. It will absorb on its own. Something we may call it a stork bite, which are very common, Mongolian spots. All those things are common findings. It's just something that we do want to make note of that is present on the baby at delivery, so that we know that that's what the baby came in with. Because sometimes certain things like a stork bite or a Mongolian spot can look like a bruise to some people. So if it's notated on the delivery report, we know that that's not a bruise, or that's something that the baby was born with. Some things that may be considered as a significant finding. Every part of the baby's anatomy usually develops with another part of the anatomy, and it's usually internal with an external piece. And so that's why we call it a significant finding, and we want to maybe look into it a little bit further. So if your baby has something called an ear pit, which looks like a little hole near the top part of the skin of the ear, looks like maybe somebody kind of just went in and dug out a little piece, kind of what it looks like. Or if there's something like skin tags or extra pieces of the ear sitting there, or if maybe the ear is just completely missing. All of those things correlate with the kidneys, because the ears and the kidneys develop at the same time. So we may or may not order an ultrasound of your baby's kidneys, and we may pay special attention to how often your baby is producing urine, because we want to make sure that the kidneys are functioning properly. Another thing that we may call a significant finding, if your baby has a simian crease, which is the creases in the hands. All of our creases should terminate or end somewhere towards the middle of the hand. So you should never have a crease from complete side to complete side. And if you do, that's called a simian crease, and that's usually indicative of Down syndrome. If the ears are low set, or if the eyes are close together, if there's a large protruding tongue, it seems like the baby's tongue is just too big for the baby's mouth, those are usually indicative of, or an indicator for, Down syndrome. So we may want to check the baby's chromosome level. If your baby has a heart murmur, which is not something that you can see, it's something that we would hear when we listen to the baby with a stethoscope, we will probably order some more tests to check baby's heart functions and everything. Most babies will come out with a small heart murmur, but it should self-resolve in the first 24 hours or so. If it doesn't, more than likely your baby's going to require oxygen and things like that, just so that the blood flow and everything kind of self-corrects when the heart murmur closes itself off. Sometimes babies will compensate and just breathe a little bit faster with that, just to keep their blood level with oxygen adequate for their body. Sometimes when the baby has a lot of significant bruising, if it was a tough delivery and maybe what baby was rubbing up against mom's pelvis as the baby was coming out, the baby may look a little bruised on the face or their chest area. That usually leads to a higher level of jaundice, which isn't detrimental, but it is something that we do want to keep an eye on and kind of just check it out, just to kind of see where baby is at. If mom, like I talked about in another video, had a car accident, that would also lead to higher levels of jaundice. So these are just some of the findings that we kind of pay attention to, and by all means, this is not an extensive list. There are many more findings out there, but those are some of the common ones that I run into. The parents get really scared if I say their baby has an ear pit or a heart murmur. They get pretty nervous. And it's understandable. That means that, there's something that is going on with baby that we need to look into. But just know that these are things that we do run into often. So it's not something that we're not used to. So I hope you guys learned something today. That lets me know that I've done my job, and I will see you guys next week. Bye.